Hi there, my name's Sam Vollans and I'm a consultant upper limb surgeon both for adults and children. So when I was young, I was 15, I did some work experience in a hospital. I never knew that I wanted to be a doctor. I'm from a non-medical background. And when I did that work experience, I met a surgeon who invited me to come and watch an operation with him. And it was a hip replacement. And I was able to watch a hip replacement. And I went home to my dad that night, who was a police officer in London. And I told my dad that I wanted to do hip replacements when I was older. And then he did some reading and told me that I had to do medicine degree, and then that was the start of my journey from a very young age, knowing exactly where I wanted to be. Admittedly, I don't do hip replacements as part of my job, but that's how I became an orthopaedic surgeon. Yeah, in terms of things that I find rewarding, I love the fact that we see patients who have pain and suffering, and to some extent, the majority of the work that I do is a quick fix. So with regards to the trauma, we see people coming in with broken bones or dislocated joints, and we're able to fix those bones or restore the stability of a joint, and immediately a patient's able to use their arm, and they're very grateful for us having put their arm back on. And on the elective side, the planned surgery side, we see people with deformity or pain or instability or stiffness of the various joints in the arm, and we're able to do procedures for them that restore that function. So generally speaking, it is quite a rewarding career. I mean, things do go wrong on occasions, but that's the aspects that I really enjoy, seeing patients coming in with suffering and leaving with their function restored. If you come and see me, the thing that above all you can expect is to be listened to. One of the things that I pride myself on is communication. I've learned over many years that often the imaging or the stories that we get from other people aren't a true representative of your story. And I'll certainly be asking you what your problem is and how I can help you. And then my job really is to find a solution for you. It's not my job to tell you whether I can or can't offer you a solution. It's to give you the solutions and then to help you make a decision about whether that's something that you would consider for your care. So I think that all comes from a background of really good communication. I think the other thing is humility, in terms of I feel like it's really important that as surgeons we try and meet you at your level. We're not gods. We shouldn't be playing God, and it's our job to help you understand something about your condition and what might be possible to help you going forward. So I think, yeah, it starts with communication. And the final thing I'd say more about the technical aspect is, in the units I work in and in my training, we're able to offer pretty much any solution that exists, and sometimes we even come up with solutions that don't exist. So I think the other thing that we can offer you is a solution where perhaps you haven't been given an option. I think there's always an option. The question is whether the risks outweigh the benefits for you. So yeah, come and see us and have a conversation with us, and we'll see whether we can address your problems with some solutions.